Ready.
Hey, Hannah, I'm Dr. Bundrick. We'll just kind of start from the beginning. How old are you?
I'm 20 years old.
20. When did you start having trouble the very first time?
I was probably around 15, 16 years old. It kind of came out of nowhere. I was at cheer practice and we were just sitting on the floor and I got this really bad urge to go to the bathroom. And when I went to the bathroom, I was gone for like 15 minutes because nothing was coming out, but I felt like I had to pee so bad.
Mm-hmm.
And my coach came to check on me and I had to tell her I couldn't get off the toilet. I had to go home early, and ever since that day, every single time I pee, I instantly get pain, and I always have the urge that I have to.
From that moment till now?
Yeah.
You've never really gotten any relief, is that what you're saying?
I've never gotten any relief.
Okay. And that day, how were you treated? Did you go to urgent care, or how did that work?
Yeah, we went to urgent care. I think that was when I got my first, what's it called?
Yeah,
swab.
They did the UTI test.
Yeah.
And it came up negative.
Yeah, it came out negative. Then they did the where they insert the thing so they can.
No. After that, we went to the urgent care, and then a couple of days later, the pain started again, and we took her to the emergency room now because now it was so bad that she literally lifted the handles off of a wheelchair.
Yeah.
And they did an internal, and they did a swab or something. Negative.
They got a catheter specimen.
Yeah.
Yeah. And it was negative.
Yeah. And after that, we did another emergency room, and then
what did they give you though when you went to urgent care? Did they not give you any antibiotics at all?
no, because they said there was nothing.
Gotcha.
Actually, no. One time we did get an antibiotic for 1 day. It was a 1 pill.
1 day?
Yeah, it was a 1 pill. And that was it, because then they kept saying it's not a UTI, it's not a UTI, we don't know what it is.
Mm-hmm.
And the third time we went to the emergency room doctor turned around and told me it's in her head. You need to see, she has to see a psychiatrist. And
how far along after how far was that from the initial infection?
that was probably about 6 or 7 months in.
Okay.
Because it was multiple ER visits and urgent care visits. And then I had to fight to see a urologist. They never ever let me see a urologist. I actually saw, we did see
Is this Kaiser?
Kaiser, yes.
Yeah. So you felt like you were battling an insurance company
All the time.
just to get care.
All the time.
Yeah.
In 5 years, we've seen 5 or 6 years.
Yeah.
Every specialist you can think of, but I had to fight to get those appointments because they kept telling me, no, it's in her head, it's in her head. And then we finally did see a urogynecologist, and we saw her for a while. She said it was that whole pelvic floor thing, that
Fibromyalgia, whatever.
yeah, pelvic floor fibromyalgia, whatever it's called. And she had to see a physical therapist, so we saw a physical therapist every week.
A pelvic floor physical therapist.
Yeah.
And all she wanted to give her the whole time was gabapentin. And we kept saying, but it's not doing anything. And then they tried urinary suppository for the pain. That didn't work.
Yeah, that did nothing.
Yeah.
Then they gave me a cream after that to try, which burned like heck and only made my pain worse.
Like a vaginal cream?
Yeah, to put on the outside, which my pain was on the inside first of all, so I don't know how that would help, but yeah, it just ended up making my pain 10 times worse.
So basically it's been 5 years of persistent symptoms.
Yeah.
You would never go like a month or anything like that without.
Oh no.
Yeah.
I've gone like 2 hours without pain, but as soon as I get that urge to pee, and I try to pee, then I get my pain.
Do you find that it's related to your period at all?
It definitely does get worse on my period.
How? Describe your cycle and how your symptoms are.
So I normally get my period like the second week towards the end of the month, and it's pretty regular because I'm on birth control. And I've noticed starting like Saturday or Sunday, I can start like feeling my muscles just tightening up, And then the minute that I start my period, I don't, even when I use like medical marijuana or anything, it does not help because it's like my muscles are just not wanting to loosen.
When you're menstruating? So it's worse when you're menstruating?
It's way worse.
Do you know when you, so how about when you finish your cycle? Does it get better?
It's definitely not as bad, but it's definitely still very bad. So when I'm on my period, on a scale of 1 to 10, it's probably like a 12.
How long have you been on birth control pills?
I'm so sorry. 4 years?
So that started after you were having problems?
Yeah. I started taking the birth control because my periods were so irregular. I would get them like for 2 weeks at a time sometimes, or I wouldn't even get it for months.
So it really stabilized your cycle?
Oh yeah, it really helped. And I'm on the lowest dose.
All right. And so really, during this time, have you had a cystoscopy?
No.
What's that?
Where they look in your bladder?
I wouldn't let them do it.
Yeah, they recommended to do that.
Yeah, I wouldn't let them do it.
You've had ultrasounds, you've had CT scans, you've had MRIs.
Yes.
Everything that you can
X-rays.
think of.
We've even done pain management, like where they injected her. That didn't work.
Oh, that was terrible.
Tell me, what are you taking now to help with your symptoms?
I'm using like a vape, a medical marijuana vape. That has been the only thing that has helped me, honestly. But it only gives me relief for a couple of hours.
And it gives you relief in your pain or relief in the urgency or both?
Both.
Okay. So it really dissociates you from
Yeah.
your symptoms, really, right?
Basically.
Yeah. How do you sleep?
Perfectly fine. I mean, it depends. Like, if I'm having really bad pain, I normally will stay up, I'll smoke, and then I'll go to sleep, and I'll be fine for the rest of the night. When I wake up, feel like I have to pee right when I wake up. Sometimes, like, more recently, it's been waking me up in the morning, so I've been getting up at, like, 6 a.m. now because I feel like I have to pee so bad.
All right. So let's talk about, I know you've had a bad experience, but let's just go talk about today. So today, any recent blood in your urine that you've seen?
No, I've only had blood in my urine one time, and that was, I think, like the first year I started getting pain.
You saw blood?
Only a little bit though, and I never saw it after that.
And you told your doctors that?
I told my doctors, they were like, oh, it's probably nothing.
All right. And so, does it burn when you urinate?
It doesn't burn at all.
No burning?
The only way that I can describe it feels like my vagina is shattered into pieces. That is the best way that I can describe the pain.
All right. So really not burning, just urgency.
Yeah.
Intense urge to urinate.
Yeah.
Feel like your bladder's never empty.
Oh yeah. I will sit on the toilet for like 6 hours just sitting there because the only time I get some like relief is when a few drops come out, and that's it.
So you don't wake up at night to urinate?
No.
In the beginning, did you?
No.
Before you were smoking?
No. I'm a very deep sleeper.
So once you get to sleep, you're
I'm
good.
out.
Okay. And when you go urinate now, are you able to generate a stream at all, or is it just drops?
Drops.
And so you never feel empty, right?
No matter how much water I drink, no matter, it stays the same.
Do you have pain here in the middle of the lower abdomen?
Not really. It's more like on the inside of my urethra.
The urethra is one of the. So your symptoms are really focused in the urethra, and more vaginally, not suprapubically, right?
No.
Okay. What about any sexual relations or anything? Are you able to have a relationship with a?
I've been with the same guy for 5 years now.
Wow.
He's been a trooper.
Sounds like
me.
it.
But yeah, I mean, like, it's hard.
Can you have intercourse?
Not for very long.
It hurts.
It hurts way too bad, and then after when I go pee, I get pain. So it's like.
So the intercourse hurts.
Yeah.
Okay. Do you find that your symptoms are worse like the day or so after intercourse?
No,
Not
it's the
related.
same.
Okay. All right. Have you ever had such an urgency to urinate during all this time that you leaked a little urine?
Yes, actually, it's only happened once or twice.
Like, oh my gosh, I went.
I actually twice this has happened. I've peed the bed twice because of it. Like I couldn't control it.
Mm-hmm.
But
you wake up wet?
Yeah, I wake up like.
Or you wake up and you're already peed?
Yeah.
How often does that happen?
That hasn't happened since like 2 years ago.
Okay.
And it only happened twice.
Mm-hmm. All right. Okay. Well, this is it's a pretty typical case of chronic bacterial cystitis where, a young lady got an infection and it's been there ever since. There's been really no extensive diagnostic work to try to see what organism it is, and they have convinced themselves that there's nothing wrong.
Yeah.
So for 6 years, this child's been living with this, not being able to finish school. She's lost her jobs because of it.
Yeah.
And it's a simple bacterial infection.
Correct. All right, we're going to get to the bottom of it, okay?
Thank you.
All right, you're welcome.